So lung cancer screening is, I always tell people it's the newest, and shiniest screening modality on the block. I think, people are more aware of mammography for breast cancer screening, the different modalities, including fecal occult blood testing, colonoscopy for colon cancer screening. But not many people are aware that for a high-risk eligible group of patients, usually determined by their smoking history, there's actually a large benefit in terms of early detection and lung cancer mortality for an annual low-dose chest CT. And that benefit's larger than those other screening modalities, actually, that the mortality reduction is somewhere on the order of a 20 to 26% reduction in lung cancer mortality. That data is based on clinical trials, and so a lot of my work is trying to translate the benefit that we know works in the clinical trial setting to how we might be able to achieve that in the real world. And the story of the first 10 years of lung cancer screening is that we're not doing a great job replicating those benefits seen in clinical trials. And a lot of that is related to two main issues, which I would consider big leaks in the pipeline for people successfully engaging with lung cancer screening. One is that maybe 10%, maybe 15% of all eligible people in the United States, which is about 16 million people, have gotten a lung cancer screen, even one. And so we're not doing a great job in terms of uptake and finding the patients who are eligible and helping them get screened. The second is that once people are engaged in screening, like they have one lung cancer screening CT, we're seeing a lot of dropout in terms of people not following up for their next steps. Most people have a negative screen, but their next steps are still to get annual screening. And we know from the trials, actually, people's lung cancers were caught on those subsequent screens. So staying engaged in screening care is important, even if you have a negative result. For people that have a positive concerning finding, which is often described as a lung nodule, so some round, fuzzy thing on your chest CT, more specialized and dedicated follow-up is needed. And so not many people have talked about what happens to those patients, because I think there's an assumption that they had a positive finding, so they're going to do something about it. So we actually questioned that, and we did a study using our multi-site program, which includes safety net hospital clinics out of Harborview, includes UW Medical Center clinics, our own clinics. So a large variety of different patients get screened in our program. So we looked at the data from that and found that about half of patients with positive findings were having delays in follow-up care. And that in and of itself is concerning. And then we went a step further and said, well, what are some patient-centered outcomes from delaying care? And we found that there was a significant number of patients who actually had clinical upstaging of their lung cancers by the time they eventually followed up. And so really that idea of that being a major gap that needs to be addressed, that it's not all about doing the volume, getting the lung cancer screening CT. It's about creating care pathways that ensure that people stay engaged, that people understand their findings, understand what their follow-up looks like, and get a little bit of help if they need it to achieve that. So I have two studies that are ongoing that this kind of provided a lot of the theoretical basis for, to do patient navigation for lung cancer screening. So patient navigation is kind of a set of interventions that are very patient-facing and usually provided one-on-one between a patient navigator and the patient to really help them overcome what are their personal barriers to completing and thriving in their own cancer care continuum, be that screening or actually cancer care. A lot of centers have done this for patients with cancer. Less places have thought about it for cancer screening. And so we have two ongoing studies where we use navigation to help patients throughout that continuum, to help them get that first scan, to help them understand the results of the first scan, to help them figure out how they're going to get to their follow-up, to help them schedule it, to interface with doctors, to provide other resources like smoking cessation that often go hand in hand with lung cancer screening. So I'm really excited to see that. I'm excited to hopefully show that this has value. and because it ultimately becomes a value proposition to the center to say, hey, this is something we should probably invest in to make sure our patients are getting effective screening care.